Good afternoon, everybody. My name is Dr. Rania Qedra, consultant obstetrician, gynecologist, working currently at Medcare Sharjah Hospital. It's my pleasure to be here with you today to take you through the maternal journey. During this session, we'll try to answer your concerns, highlight few important topics during the maternal journey, taking you to healthy and peaceful delivery. Having your baby is a pleasurable memory which no one can forget. It is our job here to make this moment more pleasurable, more memorable, with all your concerns answered. Today, joining me, Mr. Anas from the marketing department. Hello, Anas.
Hello, doctor. How are you?
Fine.
Thanks for today.
Thank you.
Are you ready?
Yes.
We're ready to go.
Yes.
All right. Doctor, one of the things that we usually hear about that there is trimesters about the pregnancy. So can you please explain it to us?
Pregnancy is divided into 3 trimesters: the first trimester, second, and third. Each trimester consists of 12 weeks. So from the beginning of the pregnancy, from the beginning of conception up to 12 weeks, that's the first trimester. From 12 weeks to 28 weeks, that's the second trimester, and then we go to the third trimester. Each trimester, Anas, has its own concerns, complaints, diseases, and memorable moments. Each trimester has its own moments.
So that would say that first trimester is between
The day of conception up to 12 weeks.
12 weeks, it's how many
3
months,
months.
doctor? 3 months.
Roughly 3 months, yes.
And second trimester?
It is from 12 weeks up to 28 weeks of pregnancy.
28 weeks. It's this will be like the total of 6 months? 4
Yes,
months and a half.
Yes, 4 months and a half, and then the rest will be the third trimester.
Third trimester is going to be like until the 9th month.
Yes, until the delivery.
Okay, what's the risks that you...
Briefly, we can talk about during the first trimester that pregnant lady suffers from nausea, hyperemesis. She feels she wants to vomit. She can long for food, sleepy, tired, crampy pains. Sometimes she gets a few spots, and that's what made her come.
Moody.
Yes.
I'm guessing that moody.
Yes. Throughout the pregnancy, the lady gets more nervous, more moody. She needs support. Second trimester is more concerned with indigestion and heaviness, urinary tract infections, vaginal infections. During the third trimester, mainly it is the heaviness. She is heavy. She is carrying another human being. She is heavy. Sometimes she can suffer from high blood pressure or diabetes or infections as well, bleeding. So with each trimester, there are certain diseases which are concerned with that trimester, and she needs to seek advice at these concerns.
So, doctor, from the trimesters right now that you explained to us, can we say that when is the best time to come and consult a doctor?
Yes, exactly, and this is an amazing question. The journey starts pre-conception. It doesn't start when she falls pregnant. When the lady had plans to get pregnant, she needs to consult her doctor. It doesn't mean it's an obstetrician, it could be a medical doctor. If she is suffering from diabetes, or from high blood pressure, thyroid problems, kidney diseases, she needs to consult her medical doctor to optimize her treatment. Sometimes the doctor has to stop medications which are harmful for the baby. They need to add another treatment. They need to substitute, stop one medication and prescribe another medication which is safer in pregnancy. She needs to optimize her weight. She needs to optimize her nutrition. She needs to take supplements. So that's very important. It's the preconceptional consultation. When she plans to get pregnant, she needs to share that with her general doctor, with her medical doctor, to optimize the condition, so when she falls pregnant, she's at the top of her healthy state.
Of course. Usually, doctor, that question is that most of the women, I feel like they have their own ups and downs that they follow up with.
Yes.
And that's because you just mentioned to me that they can go and see their medical doctor in general if they have a different diseases, but usually they have their own consultant or they see their own gynecology. Do you recommend that before, if they are not pregnant, to go directly to their medical doctor for if they are pregnant? Or there is special treatments, it should be only directed with the gynecologist?
Yes. No one can deny that the multidisciplinary approach that me, my medical colleague, my nutritionist, my physiotherapist, it's a multidisciplinary. It doesn't mean that she's pregnant, that she's just coming to see me or my colleagues in the obstetric department. We need to police together, so she would be in a safer state, she would be in an optimized condition, so it's a multidisciplinary. We discuss things together, we change medication together, we follow the patient together, so it doesn't have to be the obstetrician. At any point, if we need the help of other colleagues, we do share with them this help and ask the patient the mother to see them as well.
Got it. Okay, doctor, so can we say how frequent you plan the visit with the doctor?
Yes, this is a good question. During the first trimester, we see the lady every 4 weeks. Honest, I'm talking in case the lady has no concerns. She doesn't have bleeding, she doesn't have pain, she doesn't have over vomiting. The regular visit to the obstetrician during the journey of pregnancy, during the first trimester, roughly we can say every month, every 4 weeks. When I see her today, I plan the next visit after 4 weeks. After 28 weeks of pregnancy, it will be bi-weekly, every 2 weeks. And every visit, I will come to tell you what we check in every visit. After 36 weeks, then we see her every week. But this is in case the lady has no risk pregnancy. She has no blood pressure is high or diabetes condition or no other medical condition.
Pregnancy طبيعي.
Yes, the fetal movement is good, the baby is growing well, the amount of liquor surrounding the baby is good. Any problem, these visits get shorter. We might need to admit the mother just to make sure that the baby is in a good surveillance and in good state. So roughly it is every month up to 12 weeks, every 2 weeks, after 28 weeks, after 36 weeks, it is weekly. And it depends on the concern. If any concern raised, it's an emergency, we might need to admit if she's bleeding, if less fetal movement, if the blood pressure goes up or the diabetes we cannot control.
Doctor, just a question came to my mind right now. Which mom do you know the gender of the baby? Exactly what's the best scenario?
Gender of the baby we can start seeing from 12 weeks. 12 weeks, some genders we can see, it depends on the position of the baby.
Yeah, the best scenario is 3 weeks.
The position of the baby and the amount of fluid surrounding the baby. Fortunate nowadays we have blood tests, which we can from day one know what is the sex of the baby.
Really?
Yes.
Blood tests can
Yes. Okay. And that gives the idea about the chromosomes, and it's done in the first trimester. That gives idea about what chromosome that the baby carry and the sex of the baby. Actually, we do this test not in the high risk group. We don't do this test to know the gender of the pregnancy. We do it in cases of elderly pregnant mommies, above 40, above 45, just to make sure that their chromosomes are healthy and normal from the first trimester.
So to check on the baby, but you can know the gender from the chromosomes as well.
Yes, of course.
But
it will come back as
is it
XY.
accurate 100%, doctor? What can we say yes?
These tests is accurate, but seeing it by ultrasound, 12 weeks, 15 weeks, there are chances of mistakes. So we said, okay, we are not very sure. We need to reconfirm.
Oh, okay. Doctor, so what should the pregnant lady eat?
Yeah, that's a good corner that we can discuss. Healthy, balanced diet is important for everyone, pregnant and non-pregnant. It's me, it's you, it's everyone. Plenty of fluid, plenty of fluid. You need 2 to 3 liters of water, water. No sugars, no artificial juices, plenty of fluids. Vitamins and minerals we take from vegetables. magnesium, zinc we take from papery vegetables. So plenty of vegetables in each meal. Proteins, it can be meat, fish, chicken, lentils. Protein should be there, and fibers. Fibers would come from the vegetables and fruits. It doesn't have to be the whole fruit. She can take half of the fruits. She needs snacks in between the meals. There are 3 meals. Snack at 10 p.m., 10 a.m., 3 p.m., 11 p.m. Small snack, but healthy snack. She needs to take milk. She needs to take. It's a balanced meal. Proteins, carbohydrates. We reduce the carbohydrates so she won't increase in her weight. The average increase of weight is 2 to 4 kilos per month. If she increases more than that, give me an idea that she might have diabetes or she's going to increase her blood pressure. So healthy diet with all her follow-ups. Every visit the lady comes to our clinic here, we take the blood pressure, we check the urine, we take the weight. To me, it doesn't. To me, if she's 50 kilos or 90 kilos or 120, it doesn't raise my concern as the difference between the weight in each visit. If I see a lady who had put on 4 kilos or 5 in a month, then this is raise my concern that there was something happening inside which is wrong. Maybe her sugar started.
The mother increased her weight.
Yes. Excessive weight gain. Yes.
Okay.
And as well,
but it should be kind of normal because if I think about it as a normal person, maybe because she's pregnant and the baby is getting bigger, so she might
exactly.
And she's
so we allow her 2 to 4 kilos.
If she goes more higher than that,
in 4 weeks. 4 more than 4 is excessive.
Okay, per month.
Yes, per month, per 4 weeks. Yes.
So each month she's gonna gain maximum.
Every week half kg.
Okay.
Yeah. The average weight gain in pregnancy is 12 to 15 kilos, but some ladies goes up to 30 kilos.
Oh, yeah. Okay. And that's why they go for the exercise as well.
Yes.
To bring it down.
We'll come to the exercise.
So yeah, okay.
As well.
Let's continue about the food.
Yes. So it's a balanced diet. Reduce your carbohydrate. What I mean is bread, pastas, rice. Don't eliminate. Take a small portion, say 10 or 15%. Take more vegetables, take protein, plenty of fluids. And your vitamins. We do supplement vitamins because not all the dietary requirements we can take from food. The supplements are there during pregnancy. From the first day, in the first trimester, we give folic acid. After 12 weeks, we give vitamins, we give calcium, we give vitamin D, we give omega. Omega is very healthy for the pregnancy. It's very healthy for the neurons of the brain development of the baby. So it has to be balanced, healthy diet.
Okay, and doctor, we were discussing also about the exercise. So
yes.
Now, can we take the exercise?
Physical workout. During pregnancy, we don't have to start something new. If she's an aerobic trainer, she can continue doing that. If she walks every day, she can continue walking. But don't start something new. There are a lot of antenatal classes nowadays which help the lady to maintain her fitness during pregnancy and help her not to increase her weight. But don't start something new. Don't start to diet and exercise when you know that you're pregnant. What you used to do before pregnancy, continue. You can. A little bit of physical activity, avoid weight-bearing exercises because there's a baby and we don't know how efficient is my service. We don't want premature deliveries, we don't want premature labors or bleeding.
So usually in the trimesters, is there a risk to start continue doing exercises? Like what is the risk of high jumping? Let's say.
No, she can't jump. There's a baby, there's a placenta. Placenta is very soft and very fragile, and we can avulse the placenta and cause abortion. No jumping, but walking, swimming is a very good exercise. It's a healthy physical workout where you don't have weight bearing. You can maintain your physical liability with swimming. So, but no jumping.
No jumping at all. Okay, running.
No, running jogging. As well. Jogging, she can do that. Walking is a good.
These can help more.
Yes.
But would that be related a little bit that would that affect the diabetes, or in somehow she's burning calories, and if she might be diabetic?
For the diabetes, when we know that they are diabetics, we'll come to that. Actually, the diabetes comes in pregnancy in pre-liable people. It's not me or you. In case I'm susceptible to diabetes in pregnancy, that means if I carry a family history, if I had diabetes in a previous pregnancy, if I have a previous big baby, then I might get diabetes again this pregnancy. And it is called gestational diabetes, Anas. Gestational diabetes usually happens after 28 weeks of pregnancy, when we get our placenta grown to a size that it will release hormones and materials which break my insulin. The placenta won't release these hormones before the 28 weeks of pregnancy. So, like glycogen, growth hormone, there are many materials secreted by the placenta approximately at the age of 28 weeks and start to compete with my insulin, the insulin of the pregnant lady. And that's why the diabetic states start to become more clear. It's not in everyone, it's in susceptible people. And when we diagnose the lady for having gestational diabetes, then we start with diet, a bit of increased physical activity. My nutritionist colleague would be helping me. We will follow the lady very closely every week with cereal sugars. We need to check her sugar after food, before food, and fasting. And if she, usually people and pregnant ladies respond with the diet. If not, then we need to add medication, which help her to reduce the sugar. If not, then we have to start on insulin. But usually nowadays we are on medication and increasing the physical activity and diet, we get into
That's
controlling the
called
diabetes.
gestational diabetes.
Yes, and it won't exist before 28 weeks except in very high risk pregnant ladies. And these ladies actually they are diabetics, but they are not diagnosed.
But doctor, this gestational diabetes, does it only come when you're pregnant, and does it disappear after pregnancy?
Yeah, good question. It's called gestational. That means it comes in pregnancy. Yes, it comes in pregnancy, and it's supposed to disappear because if the cause was the placenta, once the placenta is out of the uterus, maybe it's delivered, placenta is out, these competing hormones is out. We're supposed to go back to normal, and then we have no diabetes. Unless the lady is susceptible or she is diabetic, as before pregnancy, then she is diabetic. We diagnose her. So these pregnant ladies, after 6 weeks of delivery, we bring them back to the gynae clinic and we check their diabetes status. Mostly, they're back to normal. But mind you, 50% of the gestational diabetic mothers during pregnancy, they are diabetic patients after 10 or 15 years. So having diabetes during pregnancy, that might alert the pregnant lady. She needs to increase her physical activity, she needs to maintain her weight, because she is a susceptible candidate for type 2 diabetes later on in life.
Oh, that might affect her.
Yes.
Okay. Thank you, doctor, for this
And she will
I never knew about it. Like it might be, but probably because like they have a history from the family, and she's like 99% she might get diabetes, and when she's pregnant she might get it faster.
Yes, but for next pregnancies, most probably she would be gestational. Yes.
Okay, doctor. Now can we do a little bit of talking about the traveling advice?
There's no risks of traveling during all the trimesters. Pregnant mothers can travel, but with little concerns. During the first pregnancy, she needs to hydrate herself very well because she is nauseated, and then when she travels, she'll be more nauseated. She needs to take her antiemetic treatments with her. Towards the heavier stage, second and third trimester, she needs to drink plenty of fluid before travel and during the travel itself. It depends on the hours of travel. If she's traveling more than 7 hours, less than 7 hours. In some big ladies, I mean heavy ladies, where there is risk for clots in the legs, we need to give injections which make the blood soft the clotting factors, so she won't have clots. During pregnancy, it is hypercoagulable state. That means that the blood clots in the legs or in the chest easy because of the high clotting factors. So we need to make her journey safe. If it's a long flight, sometimes we need to give aspirin or injection to make the clots softer. So what only concerns us as obstetrician during travel is the risk factor of her developing clots during the long stays and the long journeys. She doesn't have
clots. Doctor, sorry, the clots will be in the legs, right?
Yes.
Okay. And
Jalta.
oh yeah,
Yes.
جلطة. فهمت عليك بس.
She doesn't have to exert herself a lot during packing. She doesn't have to carry heavy bags because that might abrupt the placenta. Plenty of fluids and exercises. We show them how to do the foot massage during the flight or the train, or she need to dorsiflect her legs just to make wash up of any small clots in the legs. Yes, but she can travel. She can enjoy all the trimester of her pregnancy if she wants to travel. Towards the end, we are scared of premature delivery. And she can deliver at any time. After 30 weeks, 32 weeks, we don't know. So she has to come to her obstetrician, visit her, let her assist her, make sure that the baby's okay, placenta's okay, there's no lying placenta, and the cervix. That's the opening of the uterus. Sometimes they are dilated, they might deliver in the flight.
So what's the best time, let's say, between what week that they should travel or think about traveling?
There are flight rules that no flights, some airlines says 30 weeks, some airlines says 33 weeks. There is a cut-off point to not to travel beyond that date. But even if she wanted to travel beyond that day, if she visited her obstetrician and she assists her and she finds out that the service is competent for the travel, she can still travel. Yes, especially if emergency travels.
Okay, and doctor, there is something about the traveling which is I don't know, I heard about it, is that with the pressure, because you're in a high pressure up above in the sky, and would that affect somehow the baby, because we were talking about the clots most of the time?
No, it's not the high pressure, but sometimes people who travel on the height of the mountains, oxygen get less, and babies get smaller. Yes, in the heights of the mountains. But no, the pressure of the airplane, but it's how ready was she to travel? You know, they exert a lot of effort to pack their things and to shop before the travel. By the time she travels, she is really tired.
All right.
Here where we get risks coming up.
Okay. Awesome, doctor. Thank you for that. Now, another thing is that I wanted to ask you is that how can twins pregnancy happen? Is that something like regularly? Is that something we can
twins are blessing. Yeah, it can happen when the fertilized ovum divided early in pregnancy, sometimes even before implantation. What I mean by implantation, when the egg meets the sperm and it's a zygote and it implants in the uterus, sometimes start dividing into 2 or 3 fetuses. Most probably they are sporadic, that means they don't run in families. But we got a lot of twins. Nowadays, because we have assisted conception techniques like IVF, ICSI, so we have a lot of twins, triplets.
Wow.
Yes, we have a lot because we induce ovulation. What I mean by induce ovulation, giving medication to give more follicles ready for pregnancy, and so we get 2 or 3 fetus, sometimes more. We need to reduce them. We get 4 or 5 pregnancies, we need to reduce 2 or 3. Yes, twin pregnancy do exist, and they're of 2 types. They might be similar, zygotic, they might be frontal, so they are not alike. You get one blonde and one not blonde.
Yeah, so they're not going to be like twins.
Yeah, but they are blessing.
But at the same time,
we as obstetrician, we have to make sure that they are not conjoined.
Isn't that risky a little bit to choose like twins? Risky.
Yeah, it's risky. A lot of people would like twins, but twins have their own risk. We get high blood pressure in twins, we get more diabetes in twins, we get a lot of premature deliveries in twins. Twin babies tend to deliver early because if my uterus accommodates 1 baby up to 9 months, if there are 2, then I can get them in 7 months. and premature deliveries is with with a lot of risk. They need incubators, they need special baby care units, they're small, the oxygen we give them can affect their vision, their hearing. Yeah, it's with a lot of risk. We can lose both of them, that we might lose them before the survival age. We can abort them first trimester, second trimester. So, okay, in case we need to induce ovulation in infertility cases, we will go with that. But it's not, oh, I want twins, let me go and have twins.
Yeah.
And now there is a lot of sex selection as well. I want boys, I want
Gender.
girls, yes. So people just go for assisted conception for gender selection.
So, Doctor, finally finished all the questions that we have. Thank you so much. It was
As I told,
lovely.
it was my pleasure.
Really,
Thank you, Anas.
I had a lot of knowledge today.
Thank you very much, and thank you for being with me today. Hopefully, we will be together in many more sessions.
Sure.
I am Dr. Rania Qedra, consultant gynecologist, working at Medcare Sharjah. We will be, me and my colleagues and all the family of Medcare Sharjah, more than happy to serve you at any time. Thank you.